All right, welcome everybody to our Facebook Live for this month. For the month of, hold on, getting a warning again. Okay, give me 1 second. It wants me to close some stuff. So we're gonna close some stuff here. Okay. So hopefully the computer is going to be happier now. So apparently I like to live with too many tabs on. What we were talking about this month though is heartworms. There is a lot of confusion about exactly what heartworms are out there in the world. So we're going to start addressing that, and then we'll get into a little bit of prevention. Also, in discussing what they are, we're going to talk about why we would care and why we would want to prevent them to begin with. So we're going to dive into that. Just a reminder before we get started, we do encourage you to ask questions as we go. I love interaction. I am much better at answering questions than I am at just coming up with a script on my own. So definitely appreciate anything you specifically want me to talk about. So with that, we're going to go ahead and get started here. And there he is. So I'm also going to attempt to do something a little bit different. I'm going to attempt to share my screen a little bit with you guys this time as we go through to try to help explain a little bit of what it is that I'm trying to describe. So what we're going to start with as we get into this is what exactly is heartworms, and kind of along with that, how do dogs get it, and is it a cat thing or just a dog thing? Because we typically talk about it just for dogs, but it can happen to both species, dogs and cats. So with that, what are heartworms? Heartworms are a parasite. They are a worm. However, they are not a gastrointestinal worm, which means they are not a worm that lives in your GI tract. They are a worm that lives in your bloodstream, and they are carried by mosquitoes. So when the mosquito bites, it's going to go into the bloodstream of the pet, and it's going to float around in the bloodstream in one larval form, and then it's going to attach in a major blood vessel in between the heart and the lungs, where it's going to grow, it's going to reproduce, and it's going to continue to live out its life cycle. Okay? The real problem with this is that they are reproducing in the heart, blocking the heart, making it inefficient, making it difficult for the pet to survive. As they continue to grow in population, they can cause arterial blockages, pulmonary blockages. They will make them very prone to throwing blood clots, and they're also prone to causing anaphylactic reactions as they die of old age or move on if they haven't managed to completely block the blood vessel. So let me share my screen, because they actually have a fairly decently complicated life cycle. So we're going to do that here. And I saw the little button to do that, and yet now it seems to have run away. So I'm very sorry, but give me 1 second to see if I can figure that out, because I really would like to show you guys this life cycle that I have here. And I thought I knew how to do this because I practiced, and now it's not going to let me, I don't think. Well, that's a bummer. It was right there when I practiced. So I guess with that, I will do my best to describe this for you, and I will try to make sure that we post this up onto our website. All the things that I wanted to share with you were from the American Heartworm Society. It's the governing body and organization that keeps tabs on incidents of heartworms in dogs and cats. It has a lot of great resources for information on there, and it's an excellent source. So just kind of run through the chart I was going to share with you. Let's say we take Fluffy, and in this case Fluffy's a dog, because dogs are the most common to have heartworms. And the mosquito's going to come and he's going to bite Fluffy, and the mosquito's infected with heartworms. Okay, so what's going to happen is the mosquito is going to bite, and then in the tissue underneath the skin, the larvae are going to develop for about 2 months. Okay, then they're going to move into a developing adult in the bloodstream of the dog, and it's going to float around, and it's going to be about 4 to 5 months then from the time that he initially got bit. And then it's going to finish maturing, okay, and it's going to have attached to the side of that blood vessel at that point, and it's going to make babies for approximately 5 to 7 years. So it can sit there and reproduce in that dog for a long time, okay? And the problem with this is that the population continues to grow, more and more of them are reproducing, and as they're reproducing, those eggs that they reproduce then go and float around in the dog's bloodstream. And then you can have a different mosquito named Frank who's going to come and he's going to bite this dog that currently has a heartworm infection with all of the little eggs floating around in his bloodstream. And Frank wasn't infected with heartworms previously, but it eats off of Fluffy. And then Frank, our mosquito, suddenly gets heartworm. Now, this is not going to affect the mosquito at all because only this little larval form, this little egg form, is going to, because it just ingests the larva. Okay, it's not going to actually infect the mosquito. And then the larvae are going to develop in the mosquito, okay, until it becomes infective, and then it's going to move to the mosquito's salivary glands so that it can pass it on. So let's say Fluffy, our dog, he's had heartworms. He's in that 5 to 7 year portion of it right now. So he's got a lot of eggs floating around there. Frank, our mosquito, comes and bites him, gets all those eggs and larvae, and they mature in Frank, and they go to his salivary glands. So now Frank's going to come over here, and he's going to bite Spots. And Spots is our cat in this scenario, okay? Because cats can get heartworm too. So Frank's going to come over, and he's going to move over, and he's going to bite Spots. And then what's going to happen is very similar to what happens in the dog, is the larval form of the heartworm is going to grow into the tissue and underneath the skin there of Spots, our kitty cat. But the timeline on it is slightly different. So it's going to develop there for about 2.5 months. So it takes a little bit longer in cats. And then it's going to go floating around in Spot's bloodstream, developing into adult over another 4 to 6 months. And then it's going to become a mature adult in a cat. Now, here's why we don't talk about heartworm in cats nearly as often, is that very, very rarely does an adult heartworm live for long enough in a cat to really produce larvae, because they're not a natural host of heartworms. So the chance of that little larva coming out of Frank, our mosquito, and going into Spots, our cat, making it to adult, reproducing adult level, is a lot rarer because it's a lot harder. It's not a natural host for them. It can happen though. And what ends up happening for most cats, unfortunately, is they get really sick with it because they're not able to really handle this. And then the mature adult will only live for 2 to 3 years. Because of this, because there's usually less than 6 worms of a total infestation in a cat, even in a really endemic area, the cat is going to get a lot of scar tissue. A lot of times they will survive the infection though, but they're going to be a cat that gets respiratory disease really, really easy. So let's say Spots, our kitty here, he got heartworms. They died after 2 to 3 years. He was really sick with this nasty respiratory you couldn't figure out, but then he seemed okay, but he was really prone to getting respiratory issues later on. Maybe a cat that got diagnosed with pneumonia or COPD or some other chronic scar tissue related respiratory issue. So poor Spots ended up getting a heartworm infection, survived it. The heartworms didn't produce enough eggs or anything for Spots to be infected and infect any other mosquitoes that would have bit Spot, but Spot still has a lot of long-term damage. Okay, now let's look back over at Fluffy, our dog. Okay, so Fluffy, our dog, he, Frank, or the mosquito, bit him as well, but Fluffy got this big heartworm infestation, and pretty much all of the larvae that was in Frank's salivary glands made it to mature adulthood and started reproducing and produced this huge massive of adult heartworms. And they'll have very large numbers, okay, of heartworms in their bloodstream at a time, which is why we do have to worry about blood clots and actually blocking that artery of poor Fluffy. Okay, but it doesn't happen very fast. So unlike the cat, who gets really sick with a small infestation, The dog, because it's a natural host, will continue to live a normal life until it really starts to affect blood flow and starts to be a problem. And then the signs that you see tend to be the early signs of just simply heart failure. Okay, so you're going to see here coughing, exercise intolerance, panting when they're just kind of hanging out, which doesn't make sense. Avoidance behaviors is another thing a lot of dogs do. You'll have a dog that used to love to go on a 5 or 10 mile hike, and now suddenly, after about a mile, they're going to look at you and be like, I'll see you at home. Okay? So a fluffier dog is going to go from living this crazy, happy dog life to very quickly, and not typically age related, okay, not really wanting to do that. So, and because the worms live a whole lot longer in dogs, they live for 5 to 7 years as opposed to 2 to 3 years in cats, that kind of gives you an idea of how much longer dogs can live with these heartworms infesting in their hearts. There's a lot of gruesome pictures of hearts clogged up with heartworms, and it gets pretty nasty in our dogs. They don't really have the anaphylactic reactions that our cats have, but they do also get some pretty impressive infestations. So, and then they talk about there's a lot of misconception about who is at risk for heartworms. Most people think of heartworms as just a down south thing. So on the American Heartworm Society, and this was another map that I had wanted to share with you guys today, it's called the incidence map. And the last time it was updated was actually in 2019, so it's already a little bit old information. And it has shades of red as to how many cases per clinic they're seeing all around the United States. The vast majority of them are, yes, down south, so Texas, Georgia, Louisiana, they're going to have some really dark red spots, and then Florida has some pretty decently red spots as well. But the big thing for us that I want you to understand is that Ohio, the state as a whole, the lightest color it has is between 6 and 25 cases per clinic. And I can tell you that that's pretty on spot for where we are. We usually we're right in there, probably maybe a little bit closer to 6 in our personal clinic, but that's probably pretty accurate for where we are. We do have some hotter spots in Ohio, particularly right up in the corner of Northeast Ohio, and then also in Central Ohio and Southwestern Ohio. Okay, so if we think about where are those things, so that's going to be Cleveland, Columbus, and Cincinnati. And so yes, those are cities. You don't necessarily think about, fleas, ticks, mosquitoes, or anything in cities, but there's actually quite a lot, particularly of mosquitoes. And the other big thing that we see, particularly with those places, is we see a lot of dogs that were adopted. And a lot of those adopted dogs come from states all over the country. So even if you'd think, oh, well, it's only a down south thing, it's only from dogs that get brought up from down south, don't forget that life cycle that we talked about, and how many in ridiculous amounts of eggs that are floating around, and all of the franks that are flying around as mosquitoes, picking up all those eggs and then going and biting fluffies and spots and all over. Okay, so Frank isn't just one mosquito floating around with heartworm. He's got a whole bunch of relatives that now got a whole bunch of heartworm from the dogs that have been moving all around the country. So don't forget about Frank the mosquito. He will pop up anywhere and everywhere. And even if you have an indoor only pet who doesn't go outside, you also need to take consideration the fact that mosquitoes will get in your house even if you have screens. You do open and close your door, it's never completely sealed off. Okay, we don't live in a bubble. As much as hard as we try to keep the outside from coming in, it does definitely come in. I see that all the time with cats that have gotten bats that got in the house, and the owner's always shocked that a bat got in their house. Well, we have bats, and so these things do happen, and mosquitoes are even smaller, and everyone's seen the big daddy mosquito floating around in their wall at some point. So if the big ones are in there, the little ones have gotten in too. Okay, so keep that in mind. These are carried by little buggers that have a tendency to get in and around everywhere. I want to take this pause. We did have a question submitted. It says, I know some squeeze-on flea tick preventatives also prevent heartworm disease. What about Cerresto collars? So Cerresto collars are obviously not a squeeze-on, and they do not prevent heartworm disease. Heartworm disease is separate from fleas and ticks. and you have to specifically prevent heartworms in order to effectively prevent the disease. So Cerresto collars do not cover that. They purely cover fleas and ticks. Okay, so kind of on that note, okay, that can kind of lead into our preventative discussion and why we want to prevent heartworms. So we talked a little bit about why we want to prevent it. Obviously, it can get everybody really sick. Why do we want to prevent it year round? Because, you know, there's not mosquitoes in the wintertime, right? Well, in Ohio, our winters aren't very consistent, okay? So we'll be 10 degrees for a couple days, and then we'll jump up to 40 degrees for a day, and then we'll be back down to 13 for a little bit. So it's kind of all over the place. We never have an entire month in the state of Ohio that it doesn't get over 35 for at least a day or two, okay? It doesn't happen anymore. It will be very cold for a little while, and it will warm up, and then we'll get cold again. But we'll never have an entire month where it does not get above freezing. And I had a map for that too, which I unfortunately can't figure out how to share with you at the moment. But you can look that up. You can look up average weather per month for the state of Ohio. It's a quick, easy Google search, and you'll see that our average temperature overall is higher for the winter months, and that it is not very consistent if you took it by week or day-by-day basis. So with that, something to keep in mind is that if the sun's out, the bugs are out, okay? So if it's above freezing, you're going to get some mosquitoes. Probably not as many as you get in, you know, right now in April and May and all of that, but you are going to see them, particularly if you happen to get 2 days in a row. They all really wake up and they're going to come out, particularly if it's sunny, because it's going to be even warmer in the sun than it is going to be in the shade. So this is really a year-round problem that we really want to help prevent, okay? So with that, we do want to keep them under prevention. So what prevention do we use? We recommend a product that prevents heartworms in its entirety that's been proven to help. So the ones that we carry here in the clinic include Interceptor Plus and ProHeart injections. Interceptor Plus is a monthly chewable tablet that you give your dog every month to help prevent heartworms. ProHeart is an injection. We have to carry the product called ProHeart 12. So it's an injection that you give once every 12 months or as a yearly preventative to keep them from getting heartworm disease. What's the difference between these two? So first I'll cover the ones that we carry here, and then I'm going to briefly cover the other ones out there in the market. We're going to focus on dogs at the moment, and then I'll briefly cover cats. So the difference between Interceptor Plus and ProHeart 12. Well, one's an injection, and one is an oral that you need to have your dog eat every 30 days. They both prevent heartworm, okay? The big difference in what they prevent is that the chewable will also prevent gastrointestinal worms. And I think that's where a lot of the confusion comes into play as to where heartworms actually live in the body. Because a lot of the chewable preventatives, in fact, I'm going to go with all of them, will prevent heartworms and then also take care of gastrointestinal worms of some varying degree of the amount and type individually. So the reason we carry the Interceptor Plus is because it takes care of pretty much every single gastrointestinal worm in addition to the heartworm. And in my opinion, if you're going to be giving your dog a chewable every 30 days, you might as well give them something that's going to take care of the rest of the worms as well and actually wipe out those infections. For a lot of pets who have had chronic issues with whipworms and gastrointestinal worms, we can go through and talk into greater detail. Our best way of keeping the dog from being continually sick with whipworms, given their life cycles, is to just put them on a monthly heartworm preventative. And I really think that's where a lot of the confusion comes into play as to exactly how do they get heartworms and where do they live. So try to remember they are carried by mosquitoes, they live in the bloodstream, they do not come from the dirt or the soil, and they don't get them by eating anything. They get them simply by existing outside with mosquitoes. So, but like I said, if you're going to be giving a monthly heartworm preventative, you might as well give one that's going to go ahead and just deworm their system and keep the inside of your house as clean and spiffy as possible. So that's kind of the big difference between the chewables and the injection. The injection will keep them prevented or protected against heartworms for an entire 12 months, okay? So you don't need to worry about giving your pet anything every month, and you know that they're going to be safe. They can still pick up gastrointestinal worms from the environment though. So we do recommend dropping off a fecal sample every 6 months just to make sure that they haven't picked up any worms that we'd want to take care of to keep your house as clean as possible. And that kind of drives home the difference between heartworms and gastrointestinal worms. Okay? If you have any questions about that, definitely give me a call. Both products are safe. They've both been proven to be safe and effective in pregnant and lactating bitches. So you don't need to hesitate about which one you'd want to use. And then moving on to other products that we don't carry necessarily here in clinic and kind of quickly contrasting them. Those are a ProHeart 6, which is an injectable that you'd have to repeat every 6 months. It's literally exactly the same as the ProHeart 12, except that it only lasts for 6 months instead of 12 months, which is why we don't carry it here in the clinic. We figure if you're going to do an injectable heartworm, you might as well just come see me once a year. The other ones are all chewables, so they're all every 30 days. These include a Simparica Trio, HeartGuard, HeartGuard Plus, and Sentinel. Okay, so let's start with HeartGuard. Everyone is very familiar with HeartGuard. It was the original one on the market. HeartGuard Plus has the plus because it gets a couple of gastrointestinal worms. It does not get as many gastrointestinal worms as Interceptor Plus. That is the only difference. Other than that, it has a slightly different mechanism for preventing heartworms as far as the drug goes, but they both prevent heartworm infections if given appropriately. But the big difference is that you're not getting quite as many gastrointestinal worms. So again, if you're going to be giving your dog a chew every month, you might as well make sure your house is nice and clean. The other one, Sentinel. Okay, there's a lot of confusion with Sentinel, particularly Sentinel Spectrum, because it does get all the same gastrointestinal worms as Interceptor Plus. In addition to that, it has a growth inhibitory factor for fleas. A growth inhibitory factor for fleas is not a flea preventative. All it does is keep the flea from producing viable eggs. It does not keep the flea from biting your dog, and it does not keep the flea from transmitting issues to your dogs, causing dermatitis, all of that, okay? So the flea lives perfectly happy and healthy throughout its life, which is about a 3-month life cycle. The only difference, if they're on Sentinel, the eggs that flea lays won't be produced. But it's definitely not considered a flea prevention at all. It is labeled as a heartworm preventative. So that product gets a little bit confusing. We didn't bother to carry that product because, well, if you need to put them on a different flea and tick anyway, there really wasn't an advantage over the Interceptor Plus, and the Interceptor Plus matches up with better discounts with the flea and tick that we happen to carry. So it just made more sense for us not to carry that one and Interceptor Plus at the same time. The last one, this is one that everybody is always really intrigued by. It's the Simparica Trio, the supposedly all-in-one. It does your fleas, it does your ticks, and it does your heartworms. What it doesn't do is, even though it does do fleas, ticks, and heartworm preventative, and a couple gastrointestinal worms, it does not get all of the gastrointestinal worms that the Interceptor Plus gets, and its speed of kill. And on my other lectures, my flea and tick lectures and all of that, I really emphasize speed of kill is extremely important for your flea tick preventatives to keep from getting diseases. It's speed of kill because they cut the amount of flea tick prevention in that pill in half from their original product of just Simparica, which is a purely flea and tick product. Its speed of kill has really slowed down quite a lot. And so the speed of kill in it, I'm not as happy with. It's definitely better than nothing, but if I'm going to try to make sure that my pet is as protected as possible, I'm going to give a product that kills that tick really fast. And if I'm going to be giving it chewable every month for the heartworm preventative, I'm going to be giving one that's going to get more gastrointestinal worms. So, is it a good product? Is it a safe product? Yes. Will it take care of fleas, ticks, and heartworms? Yes. But you will still be recommended to drop off a fecal sample every 6 months, and you definitely want to make sure that you're not late on your dose with that, because that product is going to get out of the system very quickly, and your speed of kill is already on the edge, in my opinion, to prevent the transmission of disease from ticks. So kind of keep that in mind, and kind of with that, we'll use that as a segue to lead into cats by talking about another product made by the same company that makes Simparica Trio. It's called Revolution Plus. Now this is a topical. This is a topical made specifically for cats, maybe the same company as Zoetis. and it does fleas, ticks, and heartworm preventative, in addition to getting some gastrointestinal worms and some mites for our kitty cats. It is Revolution Plus and Revolution are really the only heartworm preventatives out there on the market that I'm aware of marketed specifically for cats. I think you might be able to give cats HeartGuard, but I'd have to look that up before I would actually prescribe it to a cat. Is it effective? Yes, it's effective. The Revolution Plus, I would definitely highly recommend over the regular Revolution. It actually helps to prevent fleas. The regular Revolution was not very effective after a while of actually helping to prevent fleas themselves. I think it was just on the market a long time. The fleas got used to it, but it does still seem to be effective for heartworm. And then the Revolution Plus, the plus part of it is they added in the tick preventative with it. And in adding in the tick preventative, they also made it effective against fleas again. So if you're going to go for full, complete protection for your kitty cat friend, the Revolution Plus is kind of really the only option on there in the market as far as that goes. Now, getting a topical on your cat can be a tricky thing. So if you're, and as we mentioned, heartworm disease in cats, well, it does occur. It is much more rare. It's not usually fatal in cats, so although do get long-term problems from it, so it is something definitely to keep in mind. So that's kind of really the only product, unfortunately, to really cover for cats. Can you give cats HeartGuard? I've heard about it a whole lot. It's not marketed specifically for cats, as far as my knowledge is limited to. So it's not something that I would necessarily recommend doing off the cuff or on a regular basis without a little bit more research. So I would have to look into that a little bit for you. So that kind of covers into different products. We talked about all of that. So now I'm going to move on to, okay, well, I have a dog. We'll go back to Fluffy. Unfortunately, Fluffy got bit by Frank, and Fluffy got heartworm. So now what do? Can we just put him on a preventative and wait for our heartworm? We'll name him Todd. Wait for our heartworm Todd to just die on his own? Well, it'll take about 5 to 7 years. Fluffy is gonna get a whole lot of scar tissue while we wait for Todd to die. And then when Todd does die, he's gonna have a lot of proteins on his surface that could cause an anaphylactic reaction in your dog when he passes. And if Todd has a whole lot of siblings, because he's been reproducing for 5 to 7 years inside of Fluffy, if they all die, it's going to be something that we have to watch out for over and over again as Todd and all of his relatives slowly die out their way. It's also a good way to breed resistance in the worms themselves. If you just simply put them on a preventative, the vast majority of reason that pets get heartworms to begin with is either they were not on prevention to begin with, or the prevention lapsed. It wasn't given at the right time. It wasn't given year round. We're human and we forgot all that stuff. And so Todd keeps reproducing. He gets exposed to a little bit of the preventative, which is really only effective against the larval form. And then they get more and more resistant to it. And then they start having babies that are resistant to all of our preventatives. So we do not recommend trying to do what is all over the internet as the slow kill method. If you want to look into all the research that's shown that dogs die waiting on their heartworms to die, doing the slow kill method, they die from complications of heart disease. It is not effective. It's bred a lot of the resistance issues that we're having right now in trying to treat heartworm infections. I'm going to refer you back to the American Heartworm Society. And you can read all about why the slow kill method of just putting them on a preventative and waiting for the adult worms to die is a really bad idea. Okay, so we don't do that. So if Fluffy comes in infected with a whole bunch of Todds, we are going to recommend actually treating that infection. So what's involved with that? It is quite difficult to kill the worms once they are adults, okay, because we have to be very careful to treat them hard enough to kill the worms themselves, and yet nice enough to the animal not to permanently damage the animal. Okay, so what do? First, we want to weaken the adult heartworm by giving them doxycycline. Okay, doxycycline is an antibiotic, so that doesn't make sense right off the bat. Well, Todd, our heartworm buddy, his gastrointestinal tract is typically infected with a bacterium that makes him resistant to our imidicide, which is the drug that we use to kill adult heartworms. If we kill the bacteria in Todd's gut first, before we administer the imidicide, it's more effective. So in order to weaken Todd, our heartworm, we're going to give your dog doxycycline for a month. Then we're going to treat with imidicide. Imidicide is a really nasty drug. We do see injection reactions a lot with it. You can see anaphylactic reactions a lot with it. And it's not something to really mess around with. In addition to that, as the heartworms themselves die, I mentioned that Todd, our heartworm buddy, has a lot of surface proteins on all over him, and those can cause an anaphylactic reaction. Well, I'm going to kill him, so it's a good chance we might get one of those. So when you bring your dog to us, we're going to be placing them on doxycycline. We're going to be treating him. We're keeping him at the clinic to watch for reactions to the injection itself. We're placing them on steroids to help prevent this anaphylaxis. In addition, as the worms die, sometimes they can create those blood clots even faster and cause blockages in the arteries and everything else. And so we keep them on prednisone, keep them on strict exercise restriction while they're in their treatment, trying to keep this as easy as possible for them. The more heartworms your dog is infected with, the harder it is for them to survive all of this, because the more of them are going to die. The more likely we're going to have an anaphylactic reaction, the more likely we're going to throw a blood clot, and the more likely we're going to run into one of these other major complications, which usually results in death. So we do tend to hospitalize them and monitor them after we give them the injection. You have two options for a protocol, and we do try to stage the pet to see how sick are they and how affected are their heart and lungs. We do radiographs, and we'll do blood work on them as well. And if we decide that they're, I believe it's class 3 or higher, we're going to do a 3-shot protocol. So there, we're going to send you home with doxycycline for a month. We're going to have you come back. We're going to give the first injection, monitor them for 24 hours, send them home on a whole bunch of medications, have you come back, give them a second injection, keep them overnight, give them a third injection in the morning, and then monitor them again for 24 hours here in the clinic before sending them home. And then they need to stay on strict exercise restriction for at least a month after that. And then we retest for their heartworm test to see if we've gotten rid of the adult heartworms. If they test positive still, then we need to go again. And we're going to have to do it all over again. So this comes back to our resistant adult heartworms. They're very, very difficult to kill. It's definitely not a fun procedure, and it gets very expensive. It gets really expensive because imidicide itself, which is the drug we have to use, is very expensive. The treatment protocol is very long. It involves hospitalization. And we want to stage the pet before we even start so that we can pick the best way to treat them in order to get the best outcome that we possibly can. So with all of the diagnostics that have to go into it, it adds up, and it tends to add up very quickly. Unfortunately, a lot of people whose dogs get diagnosed with heartworm disease are not able to afford the treatment. So they get onto Google and they attempt the slow kill method, which basically just makes my job even harder to save the life of a dog that gets infected with adult heartworms, making it even harder for people to afford the treatment because we may have to do it more than once, and making it even riskier because if we need to be even more aggressive to attempt to get rid of them, it's going to be even harder on the dog's body to survive killing all of them very, very quickly. So we do try to stage it. I really encourage all of you to please not do a slow kill method. If it's the only thing you can afford, try some other options. Look, reach out to rescue groups, reach out to humane societies, see if they have any funds that can help you to pay for the treatment that your dog really needs in order to get rid of the heartworms. A lot of rescue groups, particularly down south, they get a lot of dogs in that are infected with heartworms. They have funds allocated specifically for treating heartworms, and they might be able to help you out. So that would be my recommendation for that. If you're unlucky enough to have a cat that gets infected with heartworms, do we treat cats? We don't typically treat cats with imidicide because they are just infected with less than 6 worms. What we mostly do is we monitor them very closely. The worms also don't live nearly as long in cats, and they're not able to reproduce eggs and be effective that way in infecting more of our mosquitoes named Frank. So it doesn't necessarily spread from our spots kitties to other animals. So we monitor them really closely. We will try to weaken the worms with some doxycycline, and then we watch them, usually with low dose steroids, when we think that the worm might be getting ready to die. If the cat has any issues, we just try to support them through it. While the worm actually dies, if the cat goes into an anaphylaxis, we're ready. IV fluids, lots of intensive supportive care. And like I said, we can usually get them through it, but it is definitely not a fun process, okay? So it can be really serious. That's why we harp on heartworms all the time, why we push for prevention all the time, because prevention is so much easier, and it is very effective. I haven't seen a dog come into the clinic personally who got heartworms that was on prevention. Okay, all the dogs I've seen come into the clinic who have heartworms were not on prevention, or were not on prevention in the winter months, which is basically like being not on prevention, okay? Because we talked about how mosquitoes are a year-round problem, even up here in Ohio, okay? So we want to keep all of that in mind. Now down south, they're going to see dogs with what we call breakthrough infections, which means they will have been on heartworm preventative and they'll still get infected. They're going to have much stronger opinions on exactly which heartworm preventative you use in order to keep your dog best protected based off of that area. In my particular area, I've still seen effectiveness with all of the heartworm preventatives, so I encourage you, please just pick one, get your pet on it. If I'm going to give you my personal preference, I would just put my dog on Interceptor Plus, give that to him every month, because that way I know I've got heartworms, I've got all my other gastrointestinal worms, he sleeps in the bed with me, I don't want to have to worry about him having anything. And so then I know, and I don't need to worry about it anymore at all. Just give it to him every month and be done. So I think with that, I just want to say thank you to everybody at the Carroll Animal Hospital, all the other vets, and everybody at the practice here, which allow me to do these Facebook Lives for you, answer your questions, reach out, kind of let you know where we are, hopefully teach you some things you might not have known of about some common stuff that we see here at the practice. Keep your eye out for those posts. We're going to try to post the life cycle from the American Heartworm Society, and then also that incident map. Keep in mind too, when you're looking at that incident map, it is from 2019, which means it's 3 years old. And heartworms have not gotten less prevalent. If anything, they've gotten more prevalent. So it's an old map, it's outdated, and all it means is that it's not it's lower numbers than what we have today, especially with what's going on. Also keep in mind, we are running a promotion all month long on heartworm medication. They're going to be 5% off, particularly on our online store. So keep your eye out on the online store for Revolution Plus for our cats and Interceptor Plus for our dogs, to keep everybody nice and healthy. For May, we are going to be talking about National Pet Month with an emphasis on horse wellness, okay? So keep your eye out for that. We're going to be moving a little bit away from dogs and cats, so we're going to be talking particularly about horses. At least next month, we're going to be talking about general wellness for them and all of the usual maintenance things that you're going to want to keep in mind when it comes to keeping your horse happy and healthy. And for those of you who like to compete, I'll brush a little bit up on a lot of the requirements to get onto properties and shows and all of that good stuff. So if you have any questions or there's any other topics, definitely check out our past live videos. We may be able to answer some of them there. If not, definitely shoot us a line. We're more than happy to take suggestions. We love to talk about with people's suggestions. We do also have a blog and a TikTok channel, so be sure to go ahead and follow us for that. We try to post cute videos. We try to keep our blogs up to date with a lot of what's going on here at the clinic. So just to let everybody know, thank you again. I really appreciate talking with you guys, and I hope you have a lovely evening. Thank you.